The bill that broke everything. You're 68. You've paid into Medicare your whole working life. And then one Tuesday afternoon, your pharmacist hands you a receipt for $340 for a drug that cost you $30 last month. Nobody warned you. Nobody explained it. And the worst part? This is completely legal. This is called the Medicare coverage gap, and if you're on Part D right now, there's a real chance it's coming for you. About 1 in 4 Medicare beneficiaries hits it every single year. And most of them had no idea it existed until they were standing at that pharmacy counter, staring at a number that made no sense. Today we're going to talk about what it actually is, who it hits the hardest, and, most importantly, what you can do about it before it blindsides you. What the gap actually is. Let's break this down. No jargon, no fluff. Medicare Part D, the prescription drug coverage, works in 4 stages. Stage 1, you pay your deductible. Stage 2, you and your plan split costs. That feels manageable. Then you hit Stage 3. Once your total drug spending crosses around $5,000 for the year, you enter the coverage gap. Even though the Affordable Care Act technically closed the donut hole, you are still paying 25% of the cost of brand-name drugs out of your own pocket. On a $1,200 a month specialty medication, the kind a cardiologist or an oncologist prescribes, that's $300. Every single month. Out of your retirement savings. Stage 4 is catastrophic coverage, which sounds like a relief. And it is, but only after you've spent around $8,000 out of pocket first. Most people never get there. They just get stuck in Stage 3, month after month, making impossible choices between medications and groceries. The average beneficiary who hits the gap spends an extra $7,400 before the year is done. That number doesn't come from nowhere. It comes from real people making real sacrifices. Who gets hit the hardest? This isn't an abstract policy problem. It has a face, actually, several faces. It hits women harder, because women live longer on average and carry more chronic conditions. It hits rural seniors harder, because they don't have big city pharmacy competition keeping prices honest. And research consistently shows it hits communities of color harder, because of documented disparities in how Medicare plans are distributed and marketed in the first place. Here's the number that should make everyone angry. Approximately 3.5 million Americans qualify right now for a federal program called Extra Help, which can eliminate most of these costs entirely. And they have never applied because they don't know it exists. That's not a gap in coverage. That's a gap in information. And seniors are paying for it with money they cannot get back. The average annual Social Security income for a retired worker sits around $22,000. Run the math on $7,400 in drug costs against that. You'll understand pretty quickly why 1 in 7 Medicare beneficiaries has cut back on food to afford prescriptions. Canada and Australia, not as safe as you think. Now, if you're watching from Canada or Australia right now, you might be feeling a little smug. I get it. But don't. Canada's public drug coverage is a patchwork, and it is entirely dependent on which province you live in. Quebec covers significantly more than most. Alberta covers significantly less. If you retired before your employer's drug plan had a proper sunset clause, or if you're self-employed, you could be paying $600 to $900 a month for medications your neighbor gets for $40. A 2023 survey found roughly 40% of Canadians over 55 had skipped doses or cut pills because of cost. That is not a universal healthcare success story. In Australia, the pharmaceutical benefits scheme is genuinely better. The PBS is a real safety net and worth defending. But it has a threshold, and the drugs outside the PBS list are often the newer, more targeted ones your specialist just recommended. The ones that actually work better for your specific condition. Those can run thousands of dollars a year out of pocket, even with a gold Medicare card. The geography of your safety net determines your financial health in retirement. That is true in every one of these countries. The plan choices nobody explains. Every October, Medicare sends you something called an annual notice of change. Most people throw it in the recycling bin without opening it. That is a roughly $1,300 mistake on average. Here's why. Drug formularies, the list of medications your plan actually covers, change every single year. The plan that was perfectly calibrated to your prescriptions in 2022 could be quietly bleeding you dry in 2025. Your drug might have moved to a higher tier. The plan might have added a new restriction. And you would never know unless you checked. You have a window every year, from October 15th to December 7th, to switch plans at no penalty. Most people don't use it. They assume their plan is fine. They don't want the paperwork. They figure it probably doesn't make much difference. And then February comes, and the pharmacy bill arrives, and they're on the phone with their adult children trying to figure out what changed. The system runs on the assumption that you're too busy or too overwhelmed to comparison shop. 54 plans on average are available per county. The Medicare Plan Finder tool lets you plug in your exact medications and compare real costs across all of them. It takes about 15 minutes. It can save you more than $1,000 a year. Real people, real costs. I want you to think about someone specific right now. Maybe it's your mother. Maybe it's you. She's 72. She has type 2 diabetes, high blood pressure, and mild heart failure, which is actually a very common combination in this age group. She's on 5 medications. She planned carefully. She has Medicare, a small pension, Social Security. She is not reckless. She is not irresponsible. She did everything right. And somewhere around August of last year, she hit her coverage limit. She didn't skip her insulin. But she did cut her heart medication in half, not because a doctor told her to, but because she had to choose between that and the heating bill. 1 in 7 Medicare beneficiaries makes a decision like that every year. They either skip doses, split pills, or delay refills because the math simply doesn't work. That is not an individual failure. That is a structural one. And the only way it changes is if people understand what they're actually dealing with. What you can actually do right now. All right. Enough of the hard news. Here's what you can do this week, not someday. First, go to Medicare's Plan Finder at Medicare.gov and run your specific medications through every plan available in your zip code. Do this before December 7th if you're in open enrollment. It is free, it is fast, and it is the single highest return 15 minutes you will spend this year. Second, if your income is below roughly $21,000 as an individual or around $28,000 as a married couple, apply for the Extra Help program through SSA.gov or by calling 1-800-MEDICARE. Do not assume you don't qualify. The income threshold is higher than most people expect, and the savings can be dramatic. This program pays most of your premiums, deductibles, and copays. Third, call the manufacturer of your most expensive drug directly. Pharmaceutical companies have patient assistance programs. These are not charity handouts. They are negotiated assistance programs that exist partly because the drugs were developed with public research funding. Ask what you qualify for. Most people never do. Fourth, if you are in Canada, call your provincial drug benefit office and ask specifically about the senior supplement program. Every province has one. The eligibility rules vary and they don't advertise them heavily. And if you're in Australia, ask your GP whether your current prescription has a PBS-listed equivalent that achieves the same clinical outcome at a fraction of the cost. A good GP will already know. Some will need prompting. Ask anyway. Here's what I'll leave you with. The Medicare coverage gap isn't a glitch. It isn't a bureaucratic accident. It is a structural feature of a system that was built through decades of political compromise, and the people who absorb the cost of those compromises are retired, on fixed incomes, and managing multiple health conditions at the same time. But here's the thing. Knowing this exists puts you ahead of most people. And being ahead, in this system, is everything. If this video helped you even a little, please share it with someone who's turning 65 in the next year. They need to hear this before open enrollment, not after it. Subscribe if you want to stay ahead of this stuff year-round, not just when it makes the headlines. And drop a comment below telling me which state, province, or country you're in. I want to do more location-specific breakdowns, and your comments tell me exactly where to go next. I read every single one.